Hello and welcome. I'm Scott Dennis.
And I'm Jacqueline Matter. Thanks for joining us. Topping our news this hour, we know healthcare costs are a big concern in our community, but how often do you think about the cost of healthcare for your pet? Some pet owners are paying thousands of dollars out of pocket for life-saving treatments.
So could pet insurance help save you money in the long run? ABC 7's Jess Dowdrick investigates.
Cynthia Crow knew something wasn't right when she picked up her dog, Pumpkin, from the groomer.
He just didn't look right, and I said to my husband, there's something wrong with him here, very wrong.
She rushed him to the vet. Pumpkin had cuts on his ear and paw, bruises across his stomach, and a broken jaw.
It can't be fixed. It's broken for the rest of his life.
Pumpkin couldn't even be totally healed by surgery, so now he's stuck wearing this muzzle every day.
He gets special food to eat. He has medication that goes in the food. I feed him by hand because he can't eat by himself.
Bills keep piling up.
Right now it's up to about $1,700.
The money keeps coming out of pocket.
If you love your pet, you'll do whatever it takes. If I have to sell a house to take care of him, I'll do that.
Crow is kicking herself now for not getting pet insurance.
I talked about it at one time, but he is so well protected by us. We didn't think we needed it.
Pet insurance is similar to human health insurance. It can come in handy during emergency and unexpected situations. And of course, there are monthly fees.
I've seen payments range from $30 a month to several $100 a month.
It all depends on how extensive of a plan you're looking at.
They can have deductibles. They can be as comprehensive as covering wellness visits and the routine medical care, or they can be a plan for emergency situations.
The Humane Society of Sarasota County doesn't have a stance on pet insurance. They say it's up to the pet owner. The shelter staff simply suggests that any pet owner do his or her research.
There are so many plans out there, so make sure you do your research first, as well as ask your vet any questions before you invest in a policy.
Let's crunch some numbers and get some quotes to figure out exactly what kind of prices we're looking at for pet insurance here on the Suncoast.
Let's compare prices and plans for a cat, small dog, and large dog, assuming they're all the same age, 2 years old. For Healthy Paws Pet Insurance, we're looking at $26 a month for a cat and $37 a month for each a small and large dog. That plan has a $200 deductible for each pet. Over a 10-year lifespan, you'd pay $3,120 for the cat's insurance and $4,440 for a dog. Let's compare that to Nationwide's pet insurance plan. It would cost $26 a month for a cat and $27 a month for a dog. That's $3,120 over a 10-year life expectancy for the cat and $3,240 for the dog. That plan has a $250 deductible. It also offers a more inclusive plan that would cover a long list of illnesses that the basic plan wouldn't, like feces tests, deworming, and dental disease. That plan would be about $50 per month per pet, or $6,000 for the 10 years of insurance. One last comparison. Let's look at Embrace Pet Insurance. On the $200 deductible plan, the cat would cost $24 a month, and both dogs about $32 a month. Again, looking at those numbers over 10 years, you'd pay $2,280 for the cat and $3,840 per dog. So no matter which plan you look at, cats overall are cheaper to cover through pet insurance. But there are other factors that go into these monthly fees.
Breed will play a role, age just like people. Think about it like life insurance, and people, it's going to be similar. The younger you do it, the cheaper it is per month, right off the bat.
Dr. Ryan Beverly works at Suncoast Veterinary Emergency and Specialty Center on Route 41 in Sarasota. He's typically dealing with emergency situations and rarely ever sees clients come in with pet insurance.
I do have cases come in where a dog could undergo treatment that could potentially be life-saving. We can never make guarantees. And people end up going for humane euthanasia because it's either they pay for that procedure, which might work, or they keep the roof on their house.
To avoid those heartbreaking situations, Dr. Beverly suggests pet owners be prepared for the unexpected and purchase pet insurance.
I have no brand loyalty. They all seem to be good. I think it's always going to be situational.
A disadvantage, most pet insurance companies won't cover pre-existing conditions.
One big thing I don't like about pet insurance is that you have to actually pay for up front whatever service you get. It's not like human insurance where it pays itself up front. You actually have to pay it, the client does, and then they get reimbursed.
Jess Dowdrick, ABC 7, your Suncoast News.